Are there any other major red flags that you've been seeing?
Well, one that we get now a lot of because of the obesity epidemic, we're using more and more insulin. And one of the insulins that we're using when you have a patient that unfortunately becomes refractory to normal dosing, resistant to normal dosing, is U500, which is a 500 unit per mil concentration of insulin. And just recently we had a mix-up in dispensing U500 instead of U100. Some people aren't familiar with it, although it's well labeled and it looks very different from the other insulins. It still said Humulin regular insulin, which is what was ordered. The U100 is Humulin regular insulin. We've had people use a pull-down list for insulin, and it says insulin, regular, Humulin, and then it'll say U500 all the way off to the right of the screen, and it's not seen, so they choose the U500 instead of the U100. There's so many ways that this type of error can happen. And so, you know, that has been a biggie, and we're hoping, we have been in contact with Lilly, the manufacturer, and they have been trying to get that U500 into a pen dosage form. We would love to see that. It would be much, much safer. Right now, you have to either use a U100 insulin syringe because there is no U500 syringe to measure it. So every time you use a U100, that causes confusion because you think, or some people think you're only drawing up 20 units when in fact you're really drawing up 100 units, or 40 units, you're really drawing up 200 units. And the patients will even come in and say, when you ask them, how much are you taking? And they'll say, oh, I take 40 units of insulin. Well, they're really getting 200. And we have the error happen the other way around too, so people can get overdosed. So we've always recommended a tuberculin syringe, but that's all nonsense. This should be in a U500 syringe or a U500 pen. And I don't know any other way around it. We've seen two other dosage forms now, U200 and U300. And fortunately, both of those are only available in a pen. And I think that's what we would need to use U500 safely as well.